Good morning, everyone. Hope you all can hear us. My name is Padmini Ranasingh. I'm a faculty member at the School of Medicine at Johns Hopkins. I graduated from Colombo Medical School, and I'm also the president of Maryland Medical Society. So, warm greetings to the series of climate and health lectures. This is our fourth lecture. And we see the passion out there in Sri Lanka, so I'm grateful about that. And I'm going to introduce our speaker who's well known to this audience. He's Dr. Ankush Bansal. I know Dr. Bansal for many years now, and he's a clinician. He sees patients. Additionally, he has an interest in public health and climate health. So he did medical school in the US and then currently doing his MPH. And then he is a member at World Medical Association Climate Health Group, and he's the chair of that. And he's representing to COP from WMA. So he's very involved in climate and health topic for a long time. And our goal of doing this series is to give you overview of climate, health, and medicine, and some of the potential solution that you may learn from. And also, we like to hear from you what your interests are. And as you may know, our time here is almost midnight. I'm particularly grateful for Dr. Bansal for joining. So with this schedule here, and then and commitment and being part of this group and helping us to uh, give more knowledge to our Sri Lankan community and doctors. With that, I'm going to hand over to Dr. Bansal. And then if you do have any questions, just please put into the chat. And at the end, we'll try to address some of the questions. Dr. Bansal, over to you.
Thank you so much, and good morning, everybody. Thank you for inviting me again. It is amazing. I see more than 300 attendees for this presentation. So I'm very happy to present today's lecture on sustainable healthcare. I am going to be presenting a very brief overview. There will be a lot of information, but it's a brief overview. I took a certificate on sustainable healthcare from University of Colorado School of Medicine last year. It was about 40 hours of study for that. So I will be talking about some of the items in this just 1 hour here. So what I'm going to be talking about, my outline is why this is important, what is sustainable healthcare, and then I'll be talking about a few domains, not all of the domains, but some of them, such as waste processing, hospital and health system approaches to sustainable healthcare, pharmaceuticals, including life cycle analysis, metered dose inhalers as an example, and also anesthetic gases, operating room sustainable healthcare, data, so that includes just health data as well as AI. And then some other areas which I will not have time to discuss today are things like transportation, food systems, power generation, and human resources. And then at the end, very briefly, I will give you an example of a mission statement for a health system on addressing sustainable healthcare and a sample initial plan. So many of these slides I have obtained from that certificate course because we were taught by the experts from around the world in different areas, including clinical medicine, law, engineering, pharmacology, etc. So first of all, why am I talking about this? Many of you may be familiar with the Lancet Planetary Health Countdown. And if you see here in the second area, they're talking about promoting the health sector's leadership, delivering health promoting climate change action, and specifically delivering public health programs that improve public health and reduce greenhouse gas emissions. And then most importantly, leading by example, building sustainable, efficient, net zero emission health systems. So Why is this important? All of you are physicians, so you know what the effects of health of pollution are on health. So I will not talk about those things. You can see that in this picture here. However, I do want to point out that there are external factors that affect health and that cause pollution. And those are things that we as clinicians don't often think about. Those are things like hazardous chemicals, food security, microplastics, landfills, and heat waves. In the United States, as in many parts of the world, we are affected by climate change anywhere that we live. So, for example, Dr. Rani Singh Padmini, she lives in Maryland, which is in this green section at the very top. They get a lot of rain that can lead towards flooding, that can lead towards landslides. I live all the way down here at the bottom of this yellow, so we get a lot of hurricanes as well as heavy rains, and sometimes we get fires as well. So this affects everywhere in some form or another. Further, when we talk about climate change and health, we need to talk about the social determinants of health. And these are some of these that are listed on the side here. So things like poverty, occupation, discrimination of any kind, other health disparities, and then policies. So that includes social policies, health, and economic policies. And all of these affect and increase vulnerability to climate change. And just always remember that this is why we care so much about climate change and health, because these are the patients, the community members that are suffering through these and that we have to treat. So how important is the healthcare sector to climate change? So you can see in this graph that greenhouse gas emissions are significantly produced by the healthcare sector. I will provide some more data after this slide. But you can see here in the summary that the level of greenhouse gas emissions just from the healthcare sector is almost the same as the scale of preventable medical errors. That is quite significant. And in the US, they did a study, and it actually causes a loss of 400,000 disability adjusted life years just in the United States. So further, if you look at healthcare and if you consider just worldwide healthcare as a country by itself, it would be the fifth most significant greenhouse gas emitter, just healthcare worldwide. And this is ahead of United Kingdom, even all United Kingdom. In the US, our healthcare sector is bigger than all of the United Kingdom's greenhouse gas emissions. But just worldwide, it comes right after these top four. So what are some of the ways that healthcare affects climate change and makes it worse? Well, you can see here in these clouds, there are things like energy use for just the basic utilities and ventilation and cooling and that sort of thing. The medicines that we use, and I'll be talking about this later in the presentation, food systems and waste disposal, how patients and employees are able to come to work, whether they're coming by automobile, whether they're coming by foot, however those things are, general waste transport, treatment, and disposal. And this includes biohazardous waste, which is often incinerated. And then the big thing, and you'll see this in a few minutes, is the supply chain. How far everything that we use in the hospital has to travel and how much greenhouse gas emissions those cause. Looking at a different way, the effect of healthcare on planetary health. There is greenhouse gas emissions, pollution, water supply effects, land use, ecosystems, of course, health equity, and then environmental justice. And environmental justice means that if you have more affluent people, they may be contributing more to greenhouse gas emissions in any area just because they have those means, and it's affecting the less affluent people. And that may be also where waste disposal sites or in industry is located. So what is sustainable healthcare? This is one definition that comes from United Kingdom. There are four principles of sustainable healthcare. One is prevention, and what that means by prevention is use as little healthcare as possible, and that is through education of the patient and the community, how to take care of their own health, how to avoid getting sick in the first place, having to take medications, how to manage their chronic illnesses. That leads into patient empowerment and self-care. The number three is lean service delivery. And what that means is using reusable items, reducing the transit and transport of the materials that we use, and being more efficient in how we deliver healthcare. And then number four is low carbon alternatives if it is available and possible. Um, Here is another way to look at what sustainable healthcare is. There is this framework called climate smart healthcare, which looks at leadership, mitigation, and resilience. But you can also think of it as climate resilience. So what that means is you have healthcare facility resilience, community health resilience, and then the public infrastructure resilience. And all of these things are important for the healthcare systems. These are not things that we normally think about when we're working in the hospital, but all of these play a factor in the healthcare delivery system. So how do we accomplish that while considering health equity and stewardship? So, we think about some of our most vulnerable populations, whether they are minority groups, whether they are children, older adults, or those that are poor or low income. Because this is what we would like to avoid. These mountains of garbage that we see in so many countries, even in the United States. And I'll show you a picture next of one of these in the US. So this is not just in some countries, but this is in all countries. So this is an example of a landfill. The largest landfill in the United States accepts 4,400 tons of waste per day. And you can see how big this is in this satellite picture. And we want to try to avoid healthcare contributing to this, because this is the waste that we generate just in the healthcare sector. All of these syringes and needles, gloves and gowns, water bottles, other things, for us to stay healthy while we're taking care of patients. Where does this all end up? Either burned or it ends up in these landfills. And the reason further that this is important is because hospitals themselves are at risk from the effects of climate change. So this was a study that was done by Healthcare Without Harm a few years ago. They did a survey of hospitals around the world to see which ones were most at risk of either a total or a partial shutdown by the end of this century because of the effects of climate change. And you can see here 1 in 12 hospitals in the entire world are at risk of a total or partial shutdown because of climate change. And you can see even in the United States, the richest country in the world, 515 hospitals at least are at risk of shutdown. You can see here in South Asia, almost 5,900 hospitals are at risk. So this is something that we need to be ready for and try to avoid through changes in the practices of healthcare supply procurement as well as delivery. So these are some of the ways. I will talk about some of these in the future slides, but this includes sustainable procurement, setting a greenhouse gas reduction goal for the health system, renewable energy such as solar or wind or geothermal, depending on the area, creating a climate resilience plan. And what this means is if there are very hot days and this affects the utilities, or you get an increase in the number of patients because they're developing heat illness, what is your plan to deal with this? And how do you keep the hospital running with staff as well as just general operations? Recycling, electrifying the fleet vehicles if that's possible, education of the community, providing more healthy foods, which is just good generally for the health of your patients, but it also contributes to reducing greenhouse gas emissions. And then, if possible, telemedicine, carpooling, public transport, biking, walking, to reduce the use of automobiles for both the staff, the doctors, nurses, and the patients. So now I'm going to be talking more about some details about sustainable healthcare, and this goes into the science of sustainable healthcare. As I had said before, this is a very large and complicated topic. It involves a lot of different fields and degrees, and there are now master's level degrees just on sustainable healthcare. So this first graph shows how healthcare sustainability is split up according to the where the greenhouse gas emissions are coming from. So this is from National Health Service of United Kingdom. So there are three scopes: Scope 1, 2, and 3. Scope 1 is direct greenhouse gas emissions from hospitals and health systems. And this is things like fossil fuel use that's used at the facility. This is all of the emissions that are created by just the general operation of the facility. This is also the fleet vehicles. So these are the vehicles owned by the hospital. And then these are the medications that are used primarily in the operating room, but it may be in the general wards as well. That is Scope 1 emissions because those are direct emissions from the hospital. Scope 2 is indirect emissions. Scope 2 is the easiest one because this is basically the electricity for the hospital. How is the electricity generated from the grid or from the municipality or on site? Is it by coal? Is it oil or gas? Is this solar, wind, geothermal, etc.? That's what Scope 2 emissions are. And then Scope 3 emissions are all of the other indirect emissions. So this means that this is not directly caused by the hospital, but all of these products, all of these services are necessary for the hospital to provide services. So this includes things like medications. This includes things like travel for going to conferences, going to or transferring a patient to another hospital, for construction, for manufacturing, all of those types of things. So that's Scope 3 emissions. And as you can see, this is the largest scope, and this will end up being the most important scope here. So you can see here, this is an example of a survey that was done in the United States on the emission type by scope for healthcare greenhouse gas emissions. And you can see that Scope 1 here probably takes about 8%. Scope 2 takes about maybe another 10%, but more than 80% is Scope 3 emissions. So this is water and waste, energy transport, medicines, medical devices, food, etc. So this is why we focus more on the Scope 3. Not to say that Scope 1 and 2 are not important, but Scope 3 is the most difficult and it causes the most greenhouse gas emissions. So this is an example of one of the health systems in the United States. Kaiser Permanente is a very, very large health system in the United States. It is private. It is mostly on the West Coast of the US, and then the mid-Atlantic. So this includes Washington, D.C. area and Baltimore on the East Coast. And this example is what they did on the West Coast, where they created a climate action plan and they looked at things like sustainable food. And this means primarily vegetarian food and locally grown, water conservation, waste reduction, as well as several other items. And so they have developed a plan to go carbon neutral by 2050 or net zero by 2050. And they're actually making progress towards that. And this is some of the things that they have done. So this is one of their facilities. You know, in the United States, we have these very large parking lots and parking decks for the cars because we are very car centric. But what they've done is that they've put solar cells on these structures. So what that's created is 250 kilowatt solar photovoltaic parking lot canopy, 1 megawatt lithium ion battery energy storage system, and they have on-site heat and power system. And then they've also tied in to one of the US government labs to analyze this. And so what this does is it significantly reduces their greenhouse gas emissions, but it also saves them money because now they're not reliant on third-party power generation, and they're using far less fossil fuels for this power generation. This is another